I think, as I discussed before, we had I just want to thank all the epidemiologists and scientists out there who worked with us over the last 4 weeks on models. They really, many came forward and really supported us. Right now, we're in talks with a whole series of universities. We have the most brilliant scientists in the world in our universities in state after state. Some of them public health universities, some of them basic science. All of them have received NIH grants for HIV or other development of assays in the past. I've talked to a lot of them over the last few days to really ask them to develop these simple ELISA tests that could be used rapidly in their healthcare centers, because immediately it's easy to do. We've all developed ELISAs. So in a day or two after development, they could screen their entire hospital. I think that would be very reassuring to the healthcare workers who have been on the front line. We worry about them every day. And so I've really called on every university and every state to develop ELISAs. You can buy the antigens and the controls online and really work to test entire healthcare communities in your states and support them that way. At the same time, we worked in sub-Saharan Africa on what we call dry blood spots. So we're looking at, could you use that in a community while we work on the point of care test, where you just dot blood onto this paper, and then that can go into the lab and be analyzed. That would allow us to look in nursing homes and other long-term care facilities immediately. And then finally, we've reached out to the developers of the rapid test, the ones who developed it for malaria, the ones that developed them for HIV. It's exactly the same concept and process, to ask them to rapidly develop these tests, because I think we owe it to the frontline healthcare providers, not only to provide them RNA tests, but many of them have been on the front line now for 4 weeks, may have become exposed. We now know they're asymptomatic. And I think really being able to tell them the peace of mind that would come from knowing you already were infected, you have antibody, you're safe from reinfection 99.9% of the time. And so this, I think, would be very reassuring to our frontline healthcare workers. And our universities can do that by Friday. So I'm putting that challenge out to them to really work on that and do that. That's what we did in the early days. We had ELISAs up and running within days of having the antigen. And so this is what's really possible. So we're not waiting. We're asking for help now.
So potentially this could happen soon, even within this month, if people
It could
take up
happen
that
soon,
challenge?
within this month, if the universities help us. Absolutely.
Dr. Birx,
Mr. President,
Mr. President.
on Florida.